Hello and welcome to MEDICUS the Podcast, where we take you around Duke-NUS to meet the people shaping science and medicine. Today's guest is someone who's not just keeping up with technology, he's playing an active role in reimagining how we use it to train future doctors. Professor Fernando Bello heads the Duke-NUS Technology Enhanced Learning and Innovation Department, known as TELI for short. And he and his team are bringing the latest cutting-edge tools straight into the classroom. Fernando, welcome. It's really great to have you with us today. Let's start simple. How are you today?
I'm good, thanks, Brenda. Yeah, I'm very good. Quite a lot of exciting things happening. So yeah, busy, but in a very good way.
Right, now let's get straight into it. Medical education, right? It has come a very long way from the days of chalkboards and textbooks, being the paper versions. How would you describe the before and after of teaching medicine with today's technology?
Well, that's a very interesting question because so medicine and the way we teach medicine and learn medicine has evolved over the years. And I think that the technology has played a really important role because in medicine, the students have to learn not just the basic fundamental scientific principles, but they also need to learn how to communicate with the patients. They need to learn how to look after the patients, how to do procedures. So it's a wide range of skills that they need to learn and practice. And technology has played a key role. I think that we look back many years where we had primarily the apprenticeship model, where really is about seeing and then gradually learning how to perform and performing and eventually being the one who is teaching. That model in many ways still prevails. But of course, with the help of technology now, we have improved on that substantially.
Right, and speaking on improving the way you teach medicine using technology, you hit TELI, right, which was set up back in 2019 to close certain gaps. So can you tell us what those gaps were and how urgent did they feel at that point in time?
I guess that, there were some gaps, but also there were opportunities, I would say, primarily because the school has been pioneering in medical education since it started, really, with the introduction of team-based learning and then longitudinal care program and other innovations. So really, it was an opportunity in terms of with all the technological developments, seeing how we could leverage on those to continue to enhance and improve the learning and teaching of our students.
And how would you say your progress has been since 2019? It's been like 6 years already?
It's been 6 years, and I think it's been 6 really good years. It has gone quickly in a way, although, of course, at the very beginning, just before COVID, and then we had a bit of a pause there. But I think we made really good progress, both in terms of establishing the framework, the resources, and both in terms of physical resources, but also manpower that can support the leveraging on technologies to help our students and our faculty.
Right. And would you say you are, happy, proud of the progress you have made so far?
I would say yes. There's still lots of work to do, and we make progress in all the different aspects that we're looking at. So we're looking at a range of technologies from online learning. We also, of course, we're using immersive technologies, virtual augmented reality. We're using artificial intelligence. We're using 3D printing. And I think that in all fronts, we made really good progress, particularly because we're working very closely with faculty, with the MD program, and of course with the students as well.
You mentioned the MD program. We'll come to that in just a bit. I think that's something that I want to ask you about. But before that, I want you to imagine that I'm a new Duke-NUS student walking into your lab and I'm asking you, hey, Prof. Bello, what's the coolest gadget or tool that I'll get to try out during my 4 years as an MD student here? What would you say?
I would say we have lots and lots of gadgets, but the main thing for you is to focus on your education and use the technology as a means to help what you're learning. But if you want to know specific gadgets, I would say we have really cool VR headsets. We have really good 3D printers and models that we're building, and hopefully you can get involved in some of that as well.
But I also need to ask, beyond the shiny gadgets, because when we think of technology, people tend to think of, hey, I have the latest phone, I have the latest, the 3D printer, I can print almost anything with that. How does technology actually open up medical knowledge, which is, I think, what you're really interested in here, right? And science for students who might otherwise struggle a little to maybe picture certain concepts.
I think that we need to bear in mind that we all learn in different ways. Some of us are quite visual, some of us need perhaps more detail, something tangible. Some of us are happy with reading, revising. So we need to be able to cater for all that. But technology in many ways helps to make learning more fun, more interactive, more collaborative. And I guess that nowadays, particularly for medical students, there's a lot of knowledge, there's a lot of things that they are exposed to, and with the more recent tools we can facilitate that. We can summarize very effectively, we can point out where are the potential gaps where they need to focus as well.
Right. And if I had been a student before maybe 2019 or even before the newest developments in technology were introduced, I guess maybe what would have been the differences, the key differences in my experience learning about medicine and training to be a doctor as compared to being a student now?
I guess one very key difference is, I'll give you an example. We are within Duke-NUS, we are using what we call a multimodality approach to human anatomy, learning and teaching. And whereas before, even within Duke-NUS, prior to COVID, we were mostly learning anatomy through dissection, cadaveric dissection. And that has a lot of advantages, and of course it's something very important. But at the same time, we are now providing the students with tools, online tools, with immersive learning tools, with virtual dissection tools. And that really allows them to not just understand the detailed anatomy, but also the spatial relationships, how the different structures are related. They can have quizzes, they can query specific anatomical regions, they can see it labeled, they can access additional resources. So I think that has made a big difference. And although my own background is not medicine, but I hear from my colleagues that when they learn anatomy, they really wish they had access to these other resources.
Very interesting to hear what you have been getting up to at TELI. So Fernando, that was medical school, medical education before and after, those advances in technology. Now I'm curious to know a bit more about TELI's kind of philosophy, I guess, behind innovating. One thing that stands out about your department is that you don't just chase trends, right? You innovate with purpose. Why does this approach matter to you more than just grabbing the latest shiny gadget or tool?
Yes, I think that it is a really important approach, and perhaps I would say is a fundamental aspect of what we do, because we really want to try and understand what the need is. And at the end of the day, focus on the education, focus on what we call the learning outcomes. So what is it that we are expecting the students to be able to do, to learn and practice after a session. And when we have that in mind, then we make sure that we are not guided or driven by the technology, but rather we leverage on the technology as is best for the purpose that we're trying to achieve. And I can give you a few examples of that, but effectively I think that is a key principle, and also bearing in mind that when we talk about educational technology, it's not just the most fancy technology, but it's everything really. Is when we're using Zoom, when we're using any other tools online as well.
Right. And now I'm curious, can you walk us through how you would collaborate? Because you mentioned earlier in the interview that you work very closely with Duke-NUS's MD department, right, to help to teach the students. So how do you make sure that technology isn't just all fun and games, because when people think about VR, they might think of it's a game, but how do you strike that balance between making it interactive and engaging, but also making it truly useful for these aspiring doctors in their training?
Absolutely. What we do is we start by really understanding, again, what the need is, what the gap is, or sometimes it may be that we are delivering a program and it's working well, but there are certain aspects that we want to emphasize, or maybe we want to promote more collaboration, more discussion between the students. And we focus on that first of all, rather than going and saying, okay, let's explore how we use virtual reality, right? So rather than coming with a solution looking for a problem, we try to identify the gaps and the problems. And to do that, we have conversations with the faculty. We work very closely with them. Of course, we take into account and also work with our administrators and our support staff. And we, as much as we can, we engage the students as well, because it is a really important perspective. At the end of the day, they are the ones that are there learning, and that can normally suggest and identify what are the challenges for them as well.
You mentioned working closely with the faculty in the school, right? So what does that relationship kind of look like? Do they just come up to you and say, "Hey, Fernando, I have this need. The students aren't really getting this concept. I need to show it to them in another way," or what does it look like? How do they approach you, and how do you communicate with them?
It's a bit of both, really. It works in both directions. So sometimes it's the faculty explicitly coming to us and saying, "We're having this challenge." For example, we recently the school invested in a collection of plastinated specimens for supporting anatomy teaching. They're brilliant, they're really good, but at the same time they're delicate. So the students don't have access to those 24/7. So we, together with the MD program, we worked in developing an app that allows us to present the models in 3D to the students anytime, anywhere. So they have access to that. It's labeled, so it's something that they can also use as a resource to reinforce the learning. So it's kind of a two-way dialogue where perhaps us by observing we can come and suggest, but at the same time we're there to listen if there's any specific needs as well.
Right. And how important is the feedback of the students when you are, actually introducing technology or trying to, meet certain needs? How important is that your communication with them?
I would say is fundamental because at the end of the day, they are the learners. And we're doing this both to support our faculty, but specifically to try and enhance the learning. And therefore, getting the feedback is really crucial. But at the same time, we want to not just get the smiley faces or happy or unhappy faces. We really want to go down to the level in which we can understand what benefit they are getting, and that benefit, whether it translates in better understanding, whether it translates in a more fruitful discussion, more interaction, more active learning.
Let's say if I were to be working with you as an educator and trying to maybe meet this need that we've identified together, right? Just wanted to find out more about your thought process. Like, what are some considerations that you would have before introducing this gadget or this tool into the classroom? Are there any, considerations that you might think about first?
Yes, definitely. So we do a number of things. We engage in a dialogue, but if we can, we also observe. So we observe what is the dynamics, how is it working at the moment. If it's something completely new, then we always look at what others have done as well, what is out there in the literature. So we try to be quite rigorous with that to understand what are the advantages, the challenges, the disadvantages. So I would say is dialogue, observation, and at the end of the day also is engaging the students, the faculty, others, and trying to not necessarily focus on what is the most complex solution, but in some ways the opposite. What is the most elegant? What is the perhaps the not necessarily the simplest, but a solution that will do what is needed, and that also will allow us to maybe expand if needed, and go kind of beyond the current possible solution and then expand later on.
What I'm hearing is also that what the work you do at Duke-NUS, maybe let's just use 3D printing as an example here, because it's not it's widely used around the world already, but it seems like what we are doing with it at Duke-NUS is really different from what is being done maybe at other scientific institutions, other medical institutions, where the models or the 3D printed items are more to really perhaps guide clinical work, for example, whereas the 3D models here are really to help the students learn better. Is that correct to say?
Definitely, there's a strong emphasis on that. We do a range of different projects, and some of them are more research focused. But of course, the education application is a strong guiding principle, and we have a number of examples of that.
Yeah. Before we get into the specific examples that I think we're really excited to share, I just wanted to ask, have you ever received any feedback or any maybe just updates from students who have gone on to maybe work in the hospitals, and they kind of remember what they learned through some of the technology that you have introduced? Were there any incidents like that you remember?
Yes, so just recently, yesterday, I met with one of the students who is now in his final year, and he came to Duke-NUS even before joining the school to work with us in our incipient 3D printing and prototyping lab. And what he was saying is he was kind of remembering those early days when he was working on those projects, and how that has, on the one hand, given him the confidence to work in innovative projects, but from a learning perspective, how using these models has been beneficial. And of course, all it's not just the models, but simulation and other things that we do throughout the school.
Yeah, I guess when there's that kind of interactive or engaging component to your education, you tend to remember it a little bit better, I guess, for some people, because I think for myself, I'm more of a visual learner. So if you get to give me a textbook and say, okay, you memorize all these concepts, it might take me a while to get there, but if I'm able to see this is the spine, this is the heart, then I'll have that picture ingrained in my head already. Is it the same for you as well?
Yeah, I would say so. Yeah, definitely. So both visual, but also tactile. So being able to to touch and feel things, and maybe move them around, interact with them, pull them apart. I think that's something that really helps a lot.
Right. Speaking of tactile and pulling things apart, I'm very curious to know, these two items or models have been lying on the table since the start of our interview, and I've been waiting to ask you about them. So can you just tell us about the one closer to you first? What is that?
So this is a model of the lower spine that we 3D printed. And this was in conversation with one of the faculty who teaches spine anatomy. And the idea really was to try and come up with an example that would allow the students to understand not just the anatomy of the spine and spinal cord and the nerves, but also to correlate that with a clinical case. And therefore, working together with him and one of the faculty within the Office of Education, Assistant Professor Jason Lee, we developed this model and an activity whereby the students were given a short description of a patient and some symptoms, and then they had to go and look at the model and decide which part of the spine and understand that it was a herniation that was so one of the discs had prolapsed, so there was a herniation that was then interfering with nerves and causing discomfort in the leg and all of that. So that was the clinical setting, the case. But they had to then manipulate the model, pulling it apart and then understanding. We recreated the nerves in a simple way with kind of color codes to understand the different nerves, and then they were asked to place just a small section of blue tack where the herniation was likely to be based on the clinical history of the patient. So that was something that we did, where that proved to be both popular with the students, but we did not just ask them, we actually observed. So Jason did a study where he observed the interaction of the students with the model and compared that to other resources, and effectively, to summarize, he found that the model allowed more interaction, more collaboration, more discussion of the students that were working in small groups.
Right. I think this model looks it's actually very visually stimulating for someone who maybe isn't able to just take everything in the form of text or even a picture on a textbook or a computer, right? I'm curious, how much does a model like this cost to make? Is it very expensive?
Well, one of the key philosophies within our 3D printing lab is that we are really looking at producing models that are affordable and accessible. So just to give you a sense, this has been printed using a technology that is called FDM, so using filament or different types of plastic, shall we say, and therefore it's quite affordable. I would say this model is probably the cost, if we include labor for everything, under $100, so perhaps $60, $70 at most, really, at most. But the other thing that the model has is, in a very simple way, as I mentioned, we recreated the spinal cord and the nerves using wires, and so kind of being creative. But it's quite effective, and also we use magnets just to keep the different parts of the spine together.
Yeah, like what you mentioned, it's very tactile. You can actually feel them, even pull it apart. Yeah, very interesting. I also wanted to ask you about the other model that you have over here. I think this one also looks really interesting. Can you tell us a bit more about that one?
Yeah, let me just grab that one. This is a different model. This is a model of this section of the neck. And what we did here, working again with the faculty leading this part of the anatomy course on the head and neck, he really wanted to illustrate the tonsils and the I guess what happens when the tonsils are swollen and for a very specific condition. So we came up with this model and made it in a way that just using a syringe we can highlight how the tonsils are swollen. And then this was something very simple, yet very effective with the students in terms of understanding that section of the anatomy and the function and of course when this happens. And what we observe is that it allowed as well the students to discuss and then really understand the detailed anatomy, looking at not just at the model, but then going back and looking at anatomical drawings or looking at online resources or looking at the tables that we were using, the Anatomash tables.
So you mentioned there's a little syringe that is connected to the model. So do you actually pump any fluid into that?
It's air really. So we are pumping air, and again just a simple design that allows the air to. So this is for this we printed with a different technology, but then we put together the tonsils using silicone, some kind of softer materials to recreate that.
So this is what it would look like if there was an inflammation.
Correct. Yes. And understanding the placement and just seeing the mechanism of that in a dynamic way. So,
it's really interesting because this is being used to teach medical students, right? But would it be helpful as well if, let's say, I were a patient and I had some inflammation here, and because if you tell me I have tonsil inflammation, I wouldn't be able to picture that. I think if you were to show me something like that, I would find it a bit more useful. Is that something that you thought of as well? Well, I guess designing the model.
We do in fact, and I guess that it's fair to say that we look at education in the broadest possible sense. So this is of course education of our medical students, so that's a priority, but also education of patients, education of the wider general public, and we had. We work actually with the Singapore Science Centre. They opened an exhibition, I think last year, looking at brain anatomy and looking at how the difference between a healthy brain and a brain of a person with dementia. So we work with them illustrating that through 3D printing. And of course, this is something for the general public. So yeah, I think that there is a lot of possibilities there as well.
Right. And this was on display at the Science Centre?
This was on display at the Science Centre, yes, indeed, yes. So we work with them and with one of our faculty, a neurosurgeon, then he provided the expertise in terms of the anatomy and the difference between the healthy and the brain with dementia.
All right, that's wonderful, Fernando. It's really interesting to hear how you're using these creations, those innovations of yours and your teams to really just make science a bit more accessible, not just to medical students, but also to the general public. I think what's interesting about the work that TELI does is that beyond the initiatives that you've already talked about, you have another one where you focus on educating the educators who are, these people may be health professionals or even faculty who may have an interest in teaching students using technology. So can you tell us a bit more about what sparked the idea for setting up a course for these individuals?
Well, back in 2020, 2021, we realized that not just because of COVID, but of course there were real needs in terms of how do we leverage on technology in the best possible way, and therefore we did a survey questionnaire across the academic medical center, really finding out what was the state of play in terms of how confident and comfortable the health professionals and the doctors were using the technology, and we found that there was a real need. Both to use the technology, there was a need for perhaps better understanding and making the most efficient use of a range of different technologies. So that together with ongoing discussions within the school and the AMC, we put together a program an executive certificate that is Technology Enhanced Learning for Health Professions Educators. And this really aims to introduce education in the fundamentals of educational theory, and just laying the foundations to then move on to understanding affordances and challenges of using different technologies. So the executive certificate is structured in a modular way, with 2 modules that lay the foundations, and then the participants can choose between a number of electives to do 2 electives, and we offer immersive learning. We offer serious gaming, simulation, assessment, and analytics as well. So within those, they can choose 2. And therefore, the aim of the program was really to enable our educators to learn about what are the underlying theories and frameworks that support the use of the technologies, and also to understand how can we use the technologies, what are the challenges, what are the affordances. And at the same time, what we wanted to do is we wanted to start creating a community of practice that will then bring those educators together to share experiences, to share challenges as well.
I think it's really interesting to hear about this initiative that you set up to help educators learn how to integrate tech into their curriculum. But I guess not everyone might see the need, because when people think about, hey, using tech in education, I can do a PowerPoint slideshow, I can use a laptop, I can operate like different gadgets. Why is this important to me? That might be what some people might think. So I guess my question to you is, if someone were to come to you with that sort of question, how would you respond to them?
Well, I would, first of all, I will engage in a dialogue to understand where they are in their educator's journey. And of course, it may well be that they have significant experience and understand some of the concepts of education, talking about learning outcomes, aligning with assessment, understanding the needs, how do we encourage active learning. So a range of different concepts, really. So try and understand that. And if they do have that background, if they have that understanding, then I think that I would say they are safe to go and explore and use a range of technologies. And then we will try and support them as best as we can in terms of what they're trying to do, what they're trying to achieve, what is the gaps or the problems that they have. If it's someone that comes to us and says, I have an idea and I want to use virtual reality to do this, then we would try and really encourage them to, first of all, understand and see whether this aligns with the needs that they have. How have they considered the challenges of using that technology? Is it something that they want to do just because it's attractive and there's a wow factor? So I would say that in order to use the technology in the best possible way, you need to really understand what they allow you to do and what benefit they might bring, and also whether you really need that or not.
So what I'm hearing is that it really goes beyond saying, I know how to use a laptop, I know how to use a VR headset, for example. It's really understanding what it can do for you to enhance your curriculum, to enhance your lessons, and also how it can benefit your students or the people you're teaching, right? It's not so much of, can I operate, but do I understand what I'm actually bringing to the lesson using this technology? Is that correct?
That is 100% correct. And I'm sure that you had experience where you've gone to a session or a seminar and then the seminar finished and you say, wow, that was really, really captivating and fantastic and all good. And equally, you might have gone to some that are not that. So there's a big difference between being an expert user of PowerPoint and being a good educator.
Right. That's a really interesting perspective to have. But at the end of the day, how does this all ripple back to, because we started the conversation with medical education, medical students, right? I think the educators, when they understand how to properly integrate the tech into the education and they know what kind of benefits that it can have on the students, how does this ripple back to the medical students themselves? How does this benefit them in the long run?
Well, if we make use of the technology in such a way that this is really enhancing the students' learning, different aspects of that, then undoubtedly the students will benefit directly because they will be better able to learn, to capture the concepts, perhaps to have a more active learning experience. I would say that not just understanding and appreciating the concepts, but going beyond that and being able to apply them, being able to critically appraise whether this, if you're looking at in the context of medical education, of course, when they are interacting with patients, it's not just about having a checklist in the back of the brain and going through that checklist. They have to be able to communicate. They have to be able to be critical thinkers. They have to be able to have that human interaction as well. And this is something that, again, leveraging on different technologies that are adequately used can definitely be beneficial.
That was really interesting to hear your perspective on educating the educators, as well as how this all comes back to the students. So Fernando, we just had a very interesting discussion about the importance of educating the educators in this line of medical education. But now I want to speak to you about something a little bit different. Let's talk about the elephant in the room here. We have been talking about technology this whole session. But the truth is, some people are excited about technology. Some people say we should embrace it. It's the future. Others, not as much. They feel that we should be a bit more cautious of it and kind of the risks that come with it. Where do you sit on that debate?
I would say that I'm on the embrace the technology side. However, I use technology and I like technology to be used when it's beneficial, when it's perhaps even needed, when it can make a difference, right? So even though my own background is in technology, engineering, computer science, whenever I can, I kind of go away from the computer or from gadgets and just read a book or do something else. So use it, embrace it, but in a way that is, I would say, beneficial, that that is judicious, that is not just for its own sake.
Yeah. And on AI specifically, because it's been such a hot topic around the world, right? What are your thoughts on it? And same question. Is it something that you think, is there anything about it that you think we should worry about, or is it something that with balance, with I guess responsible use, it can be something that is actually, it brings a lot of hope to the world?
I do like to see it that way, that there are a lot of opportunities. I think that we need to understand what are the limitations, and particularly in the medical education, on a medical context, it's crucial that we don't lose sight of the importance of critical thinking, of humanistic interaction with patients, all of that, and at the end of the day, we can leverage on these tools that can make things perhaps more efficient, can help in many different ways, but ultimately, the doctor is a human, is a person, and the patient, of course, is a person that needs that interaction and that dialogue, that communication.
Yeah, I think it's really interesting that you mentioned that the human touch is still really important in this age of technology that we live in, right? But I still have to ask, because I think it's also a burning question, I'm sure, in the minds of all of our viewers, right, or all of our listeners. Is there a risk of, in medical education, in the context of that, is there a risk that we become a bit too dependent on the technology? So we're talking about maybe when we're training our doctors, future doctors, with all of the technologies that they have, is there a risk that they may become a bit more reliant on it as compared to their predecessors who really just had the textbooks, the chalkboards?
I think so. I think there's always a risk. And of course we are focusing on medical education and 100%, and that's why we really need to understand and not just take it for granted and say, yeah, technology is there, let's just use it, and we need to try and support our students as best as we can, guide them. We need to be keep on top of things, because it's changing so rapidly that it's not just about being aware, but it's about finding what's the best way of using this technology, and perhaps even go beyond that. Can we innovate? Can we can we lead from the front in terms of leverage on the technology and looking at how we can customize it and adapt it for the best practice and the best use by our students and our faculty.
Right. And on the flip side, how do you make sure that, I guess, because you mentioned earlier that earlier we covered how TELI innovates with purpose, right? It's always about meeting a certain need rather than jumping on a trend. But how, I guess, when using technology, how do we remind the medical students in Duke-NUS specifically that this human touch that you talked about earlier is still very, very important, and that, technology can never replace that?
Absolutely. I think that there's perhaps a big temptation to say, well, let's revise our curriculum and integrate much more technology, but actually maybe we need to do that partly, but also we need to emphasize even more the importance of the humanistic, critical thinking, all those aspects really that are fundamental, and that even though we have this substantial advances in technology and we definitely need to cover that, it should not be to the detriment of the other really important aspects.
Fernando, you mentioned that you like to look at things from a more optimistic point of view earlier, right? So looking ahead, I would like to ask you, how do you see tech and innovation reshaping medical education maybe in the next 5 or 10 years? How do you picture the landscape?
I believe that we will, at that point in time, we will be using this technology more routinely. A lot of what we're doing now is gradual introduction for good reason, because we don't want to be driven by the technology. But there's still challenges in terms of scaling things up, in terms of developing or customizing some of these so that perhaps we're having more personalized education. And I think that is probably one of the biggest challenges will be getting the balance right. Between, as we discussed earlier, between being excited and leveraging the technology, but at the same time making sure that we're teaching medicine as it should be, really, in terms of looking after the patient and making sure that the patient has as good health as possible.
And for you specifically and your team, we talked about the future, right? What does the future look like for you maybe in the next few years? Are there any exciting, or maybe even months, are there any exciting projects in the pipeline that you can perhaps tease as a way of, just letting us know what you're going to be up to?
Well, we're doing a increasing number of projects in the 3D printing space. So this is working with various specialties, clinical specialties, and of course focusing on how can this benefit our students. So ranging from simulators for learning how to do abdominal palpation, recognizing if there is liver disease, for example, the liver is enlarged or has nodules. So that's one space that we are exploring, how we can use new materials, we can use sort of robotics or technologies for that. At the same time, we are just about to start a project where we'll be exploring the use of generative AI in multimodal data analysis, so combining video, audio, text in the context of not exclusively, but largely in the context of simulation-based education, where the student is interacting with a simulated patient, and then we want to be capturing this data, and we want to be able to analyze that and provide feedback to the student, and also enhance the lessons they learn and how they interact with this simulated patient.
Those sound like very interesting projects, and we can't wait to find out more about them when the time comes. But Fernando, thank you so much for joining us today. It was really great, really insightful to hear about, first of all, the work that you're doing at TELI, so many exciting projects, as well as those wonderful models that you showed us. Then you also talked to us about how it's important to innovate with purpose, how it's important to make sure that the educators know how to properly use tech in the curriculum, and also, you gave us a very interesting perspective on how it's important to have a very good balance when it comes to embracing tech or being a bit more cautious of it. So thank you so much again for joining us today, Fernando.
Thanks, man. Thank you.
And to all listeners, thank you so much for tuning in. If you enjoyed what you listened to today, don't forget to subscribe to MEDICUS wherever you get your podcasts. You can also find the links to our past episodes and digital magazine in our show notes. Till next time!